Hi, I'm Laura from the Hospital Palliative Care team, and this is a really quick clip to help you set up a T34 McKinley Syringe Driver. They're really simple, it shouldn't take us very long, and I've got everything we need on the table ready. So obviously, I think we all know we need the T34 McKinley Syringe Driver. That will come with a clear lockable box, and the key for the lockable box is always on the drug keys. And these two come with a monitoring chart that you can get from the equipment library. If you run out of monitoring charts, you can print some off from the syringe driver policy on the hospital intranet. You'll also need a 30ml Lurlock syringe, hospital policy, it has to be a Lurlock syringe, a butterfly infusion line, a drug additive label. Some of the pumps already come with a 9-volt battery, otherwise you'll have to get one from the ward. Some water for injection and a clear dressing. What we normally do first, most of the nurses will pull up their drugs first. So with the second nurse in the drug room, check your prescription and then pull up your drugs. The hospital policy says there's a maximum of 4 drugs allowed in each syringe driver. Usually you may only have 1 or 2. The volume of your drugs is normally quite small, imagine it's 5 mils, and then you make it up with your water for injection to 22 mils. Hospital policy, always the same, 22 mils in a 30ml syringe. Then get your butterfly infusion line, attach it and really gently prime it. Only needs a small volume again. When it's primed, you fill in your drug label and attach it to your syringe. When you attach it, just check the make of your syringe because the pump will ask you that when you're setting it up. Alright, you can put that to one side and then you need to focus on your pump. So first thing, obviously, I think is you turn the pump on. Because this is a testing pump, I have to press yes, but you normally don't need to do this. And then it will self-calibrate. This is completely normal. Just wait a few seconds. The screen will always tell you what to do along with the information at the side. So it's telling me to load my syringe, but what I always do first is check my battery level by pressing the information button once. It's asking me about my battery level. If I just press the yes key, I can see I've got 83%, that's brilliant. If I had less than 30%, I would change my battery. In a moment, this will just flick back to load your syringe. All right, load your syringe. There are 3 sensors on the pump, the syringe arm, the syringe collar, and the syringe plunger. All 3 have to be correct for the pump to run. So the first thing you need to do is lift your syringe arm, turn it 180 degrees, and let it go down. The next bit is probably the bit that people struggle with most. They have to fit the cuff and the plunger into the slots. You have to look at it, line it up. If you're not happy with the plunger position, you can move it back and forth with your buttons. When you think it's about right, you have to really clip it into place. There we go. And then you place your arm back into position. If it's happy, it will in a moment switch over to what sort of syringe you've got. Now, when I checked, mine was a Terumo, but if it wasn't, if it was a plaster pack, all I need to do is press my up and down keys until the correct syringe is displayed. It's really important because it affects the infusion rate. So I've got a Terumo, that is yes, just press the yes key. It's telling me I've got 20 mils, it's going to run over 24 hours at 0.83 mils an hour. Just have a moment to calculate mentally a minute. If you're happy, you just press the yes key. And it's saying start your infusion. This is a time you'd go to your patient bedside, you check your patient ID, you check your prescription with your second nurse, and then you're going to sight your butterfly. It goes under the skin, and the most common places at the top of the arm, in the chest wall, abdomen, thigh, and if you've got a very restless person, you can often just put it in the top of the back here, and you secure that with your clear dressing. Once you're happy with that, you can start your infusion, and all you need to do to start your infusion is just press the yes key. It's telling you it's running at 0.83 mils an hour. Now you need to put your pump into your clear lockable box. The easiest way is to line up the battery area, and this bit is a little bit fiddly. Sometimes you need to just rotate where your lure lock is, clip it into place, and then lock it with your drug keys. Before you leave your patient, you have to lock your keypad, and you do that by simply pressing the information key, holding it down, watching the box and listening for the beep. It's now safe to leave your patient. With your monitoring chart, you need to check your patient at least every 4 hours. You need to check if their symptoms are controlled, if the site looks intact, there's no redness or swelling, and you need to check your pump. To check your pump, you need to unlock it. You do exactly the reverse of what you did. You put your finger on the information key and hold it down, wait for the box to clear and the beep. Now it's cleared, what you can do is you can press the information key and see your infusion summary, your battery level, and again how many mils an hour. If you're happy with everything, you just lock your keypad again, place it safely in the bedside of the patient,